I'm Yael Greenberg. I was the executive assistant here at JOWMA this past year, and now I'm officially finished, and I'm starting I'm continuing my anesthesiology residency. Dr. Weinstock Neuberger is a medical oncologist hematologist who serves as an acting deputy division director of one of the U.S. FDA's oncology divisions. After attending Yaakov Toronto and BJJ, and after a short stint as a Limude Kodesh teacher, she attended and graduated with high distinction from the University of Toronto, received her MD at Einstein, then trained at Beth Israel and University of Maryland, where she subsequently worked as an attending oncologist. She has published widely in GU oncology, including the Journal of Clinical Oncology, and has presented invited talks at national meetings, including ASCO and GU ASCO. She is a previous track leader at the ASCO GU Oncology, Kidney, and Bladder Cancer Educational Committee and a current ASCO Research Committee member. So let's get started. Dr. Weinstock, why don't we start with talking a little bit about how you grew up and what your background is?
Sure. Thanks so much. And thanks for that nice introduction. And thanks everyone for joining. I hope this can be of some help to anybody sort of coming from my background or knows someone coming from my background, or a similar background to mine. Because I do feel like when I was doing this or looking to do this, there were not that many people that I knew on the other side of things. So hopefully this could be helpful to someone. So basically my background, I was born in Toronto. I'm the youngest of 7. I would say I went to Bais Yaakov. My elementary school, if anyone's familiar with Toronto, was an elementary school called ACGME, which is somewhat, I would say, a little bit more, I guess, to the center of Bais Yaakov. But my class, sort of half of my class went on to the Bais Yaakov High School in Toronto, and the other half went to a more Mizrahi high school. But my parents chose that for me because it was very academic. My father's a lawyer. My mother was a principal for many years. And I come from a family where education is really valued, not like formal education necessarily, but like, thirst for knowledge and thinking about new ideas and talking about big ideas. Like that's what we do. My grandmother was also a principal. My grandmother was Rebbitzin Shoshana Rezel Soloveitchik. People know her as the Rebbitzin. She started Bais Yaakov Monsey, and she ran the school for over 45 years. So I was used to having really big role models who were women, who were very strong women, very academic, intellectual women in my backgrounds. But they tended to be, principals. As I said, my grandmother was a principal and my mother was a principal. So between the two of them, I guess I thought I would give teaching a try at some point. So I ended up going to BJJ, which was really something I'd always wanted to do. A lot of my cousins had gone to BJJ. I really, I heard about Rhodes and David. I really wanted to go. And I went, I had a great year. I was head of Erev Shira. I was head of the choir, which is like the big concert that we put on every year. I loved being head of choir. I was head of choir in high school and in elementary school. Like that was my thing. So I had a great experience there. But then I guess I can get into what happened afterwards, which was, I feel like your life as a Bais Yaakov girl is very formulaic to an extent, if everything goes according to plan. You go to elementary school, you go to high school, and you sort of know how to do each stage well. Like if you study, if you do well, you do excel, you do your extracurriculars, you have a nice time, a nice group of friends. You go to BJJ, and then you come home and kind of real life starts. So that's where my story kind of starts, because again, I came from a background where the women role models in my life had been teachers and principals. And that was something that I was also expected to give a try, especially coming from BJJ. BJJ really was preparing you for a career in teaching. Not a career, actually. We were told in BJJ by a wonderful teacher. She said something like, a woman can have a job and not a career. Like it was not something that was really encouraged. And so I actually got a job as a teacher in my old alma mater in Eitz Chaim, which was not something I took for granted because Eitz Chaim really had teachers who'd been teaching for years and years and years. It was very rare for them to hire someone straight out of seminary. But I got a job and, a nice group of girls, fourth grade class. Or grade 4, as we say in Canada. And I was teaching. And after about a week or two, I was like, oh, okay. Change of plans. I'll stick out the year because that's what I do. I'm not going to stop, but this is probably not where I'm going to be seeing my future. And that was a big, eye-opening moment because, again, you go to elementary school, you go to high school, you get your teaching job, you go to seminary, you get your teaching job. And then, like, what's the other alternative? Like, if that's not for you. So I remember, a few things happened. First of all, I remember calling Robertson David and saying to her, like, a lot of very ambitious, smart, driven girls go to BJJ. Not all of them become teachers. What do the other ones do? And I can't say it was something that she had a ready answer for. She said, well, some girls go into computers and some girls I think if you go to BJJ and you want to, and I'm sorry if anyone here wants me to give more background about BJJ and what that means, I certainly can do that. But if there's anything you want me to clarify, you can put it into the chat or whatever, or just raise your hand. But anyway, so I was really like at a crossroads, and again, I thought I would date the first guy I went out with who'd be like this big Talmud Chacham, and I would be the teacher, and like it would all be scripted, and that didn't work out either. And so I was ready to maybe explore other options. But coming from Toronto, I think Bais Yaakov, there's a wide range of Bais Yaakovs in different cities. Bais Yaakov Toronto tends to be more on the traditional side, tends really not to encourage college to any extent. I've never been to another school. I don't know how the messaging is, but I do think there are some schools that embrace it to some extent. So it was like not even on my radar. So what ended up happening was that the next year I thought I would give teaching, another try, but this time I would teach in high school. So I got a job teaching in Bais Yaakov High School. I was teaching Tehillim and another Kodesh subject. And Bais Yaakov had just started a post-high school degree granting program it was very much within the confines of Bais Yaakov. We had some Kodesh classes, and then the the secular subjects were taught by from teachers, and it was sort of a very sheltered, very nice program. I was like, this is great. I'll do that part-time. The problem was that I quickly realized that the degree that I would get through there was it was through a degree granting program in the US. And I was like, what can you do with this degree? And I wasn't getting the answer, like, you can use that to apply to graduate programs or whatever. I think people ended up using it if they were applying for speech therapy. I think I had a couple of classmates who did that. But, really to get into a bona fide academic setting after that degree did not really seem realistic. So it was a very nice experience. I felt like I was back in high school because there were all these girls from Bais Yaakov, and we sat in the classroom, and it proved to be a very interesting experience. One of my teachers was a man by the name of Rabbi Dr. Yaffe, who was a teacher also in Eitz Chaim. He was a Rebbe for many years in the boys division, and he had gone for a degree in psychology. And at some point, he saw that I was really kind of struggling to figure out the next piece of where I was going to go. And he said to me, he pulled me aside one day. He's like, it seems like you really want to do something big, like go to medical school. I was like, how did you know? He's like, I have one thing to tell you. He said, in our community, when you're considering a career like that, you're going to be treif. but you're only going to be trafe until you graduate. And then you're going to be the most sought after person out there. He's like, you know, when I wanted to get my degree in psychology, I was a Rebbe. I was learning, you know, full time. I was learning in my spare time, and you know, to drop that and to go to college full time was like people looked askance at it a little bit. But he said, but now that I'm finished, I get calls from Rosh Yeshiva because they need a frum psychologist to deal with their person, and I'm a really good resource for them. He's like, so you know, there will be some raised eyebrows, and there certainly were. But once you graduate, you know, that'll be the end of that. So, and he was right. So that's kind of the beginning of my story.
That's a really interesting backstory, and sets the scene for like the rest of your medical career in an interesting way. At what point did you decide you wanted to be a doctor? You mentioned that he had figured that out. Did you already know that, or was that earlier on?
Yeah, it's a good question. There were like just so many pieces that fell into play. Like I didn't know any from women who were doctors. It was like not a thing when I was growing up. So it wasn't even something I aspired to at all. We happened to have a family friend she had a daughter who was going through, like, I knew her from when I was little, and then I hadn't seen her in a few years, and she was in New York. She was going to medical school. They were more, I would say, like more modern Orthodox than we were, but we were very like she was very close to my mother. We used to have this girl's mother over at our house a lot. And one day I was like, can you tell me like how Aviva got into medical school? I heard it's very hard to get in. Like she was really the only person I knew who had a kid doing this. And she's like, yeah, you need to do research. Like you can't just, you know, get a degree. And you know, it was when I was contemplating going to college and whatever. And she's like, oh yeah, you need to get into clinical research. Like we need to arrange that for you. And she had a very good friend who passed away shortly after that, unfortunately, who had breast cancer, from Jewish woman. And her doctor at the time was this amazing oncologist named Ellen Warner. And I didn't know her. She was in my or sort of roughly in my community. And she was a frum woman who was a doctor, who was an oncologist, who was doing incredible stuff. Like if you look up screening for breast cancer in women with BRCA mutations, like she's the one who, you know, authored some of the big studies on like using MRI. Like she's a super accomplished woman. And I didn't know her at the time. And this family friend was like, you should give her a call. Maybe she can sort of introduce you to this kind of, you know, area of academics and maybe get you interested in medicine or whatever. So I called her, I cold called her, I spoke to her secretary. At the time I had started, I realized that the degree program that my school was offering was not necessarily going to take me where I wanted to go. So I actually started doing correspondence courses with a very solid university in Canada called University of Waterloo, which is a very good school. It just doesn't tend to have any frum students, but they have a very solid degree granting correspondence program. So as a stopgap, I was actually at the time planning to apply to University of Toronto for the next year, but you need to apply like way in advance. So when I realized the degree program I was attending through Bais was like not going to work out, you can't just walk into U of T. Like you have to apply like 8 months in advance. So I was going to do that in September, but meanwhile I wanted to accumulate some credits. So I applied to Waterloo and was getting those, you know, the science portion of my degree. Hopefully I was going to work through that work through correspondence courses to start making progress to that. So I called Ellen's secretary and I said, yes, I'm a girl from Bais and I'm at University of Waterloo. And I heard that Dr. Warner's doing research in breast cancer in Ashkenazi Jewish women. And I'm really interested in being her summer student. And Ellen told me this a while later. She and her husband are both oncologists. They get inundated with like summer student requests and they can't take them all and they really can't even take a fraction of them. But she said something about my call, like Bais girl, University of Waterloo, like just intrigued her. So I started working for her. I loved it. I was like, this is what I want to do. And there were, just little people that put the idea in my head, and it was as simple as like, I went to, a friend of mine was doing an extracurricular course for kids in Eitz Chaim every Sunday, one of my good friends, and she asked me to take over one Sunday, and there were two little girls sitting there doing their arts and crafts, and one of them was like, what do you do? And I'm like, I'm a teacher. They're like, my daddy's a doctor. When I grow up, I want to be a doctor. And then the other one said the same thing. And spoiler alert, neither of these girls are doctors. They've since grown up. That was like 25 years ago. Neither of them are doctors. And I was like, how come I never thought of that when I was their age? Like, it was such a foreign idea, but like, these things put like ideas into my head. And I always say this, the funny thing is the fact that I came from a background where college was so not on my radar meant that by the time I decided to go to college, like, I wasn't going to stop at a degree that I didn't want. So I had a friend actually from BJJ who came from a sort of a very, like a much more balbachish out of town background. And she was definitely going to college afterwards. And I called her once and we were schmoozing, and she's like, right, so you'll probably go into one of the Halaga professions of OT, PT, or speech. And I was like, what are you talking about? Like, Halaga profession? Like, because there are certain circles where if you get a degree, it's supposed to be one of the degrees that's considered appropriate for a frum woman to be, to be pursuing. But that wasn't even like, I had no idea what she was talking about. And so like for me, once I was enrolling in college, I was like, I'm going to do what would make me happy. And actually it's interesting. My mother went to speak to Rav Zelig Epstein, whom we weren't necessarily close with, but he was like someone that you went to be Shoel Eitzah to. He was a very big gadol and Shari Torah, I guess the past century. Now I sound old. So she went and she asked him, like, my daughter really wants to go to college. And he said, how old is she? So my mother's like, she's 21 at that time. It's like, what's the problem? Okay. And then my mother said, well, what's going to be with shidduchim? He's like, Hashem makes shidduchim. That's what he said. So it kind of evolved. But once I had the idea planted in my head, it was there was really nothing else I was interested in doing. I mean, I considered like maybe I'd be an architect or something, but once I was headed down the college route, like I think the idea of doing what Dr. Warner was doing, which is like clinical research, advancing the field, like that seemed so cool. I wanted to do that too.
That's really interesting. And it sounds like it was a really unprecedented thing in your community to go to University of Toronto. Can you describe a little bit the experience being the only Bais Yaakov girl there, what that was like for you?
Yeah. So, I mean, I'm not going to say that it was totally unprecedented. So Bais Yaakov Toronto is kind of a big umbrella. There are definitely girls there from, I mean, maybe not so much anymore because there's a new school and it's not so new. Since I graduated in 96, there are a couple new schools. So, but back when I was in high school, there were some girls who were like definitely going to go to college. It was kind of under the radar, and not under the radar, like everyone knew they were going, and like it was a certain community that had girls in my school, but they tended to go to York University, which was, well, nowadays it's one of these colleges that's like really not so safe for Jews, from what I hear. But anyway, but yes, U of T was like, I felt like a fish out of water there. But I formed support networks for myself. There was someone there who did Kirov on campus for like young women in college, and I joined his group. Yeah, even though I was really the only one there from Bais Yaakov, but it was a nice group, and I formed some very close friendships at the time with other women in different programs, and yeah, I definitely formed network. I mean, there were plenty of from students there. They just weren't necessarily the ones I grew up with or went to high school with. So, and then I had a virtual support group. There was a group called From Girls in the Ivies. And it was like this was before social media. It was like an email group. And I used to email them anytime something arose that I did not know how to deal with. And I remember specifically, we had a class called, it was a bioethics class. And it was like one of these classes that was an easy A. So a lot of the From students took it. And and none of us lived on campus. We all commuted. And I happened to have a car. Not a lot of the other students had a car. So one of them, one time, like a friend of mine, I said, like, oh, let me give you a lift home. So she's like, oh, this guy wants to come in the car. Like, can you give him a lift too? And I was like, I froze. I was like, do I give a guy a lift? Like, nothing ever prepared me for this in Bais Yaakov. So I remember I went on like my From Girls with the Ivies. I was like, what do I do? Funny looking back. But then, yeah, I mean, there were some interesting situations. Like I remember one Bio 101, which you had to take in order to graduate with an undergrad biology degree. The guy who gave it was like a complete kofar. Like he was the biggest atheist I've ever met. He like said something along the first day, like, if you believe in God, you shouldn't be in the sciences. So whatever, you roll your eyes. But then a third of the curriculum was about evolution. And I was like, okay, like I can't not take the class because I need this class. So I remember I called Rabbi Yafi back because I had remembered that when he was teaching in that Malot program that my Bais Yaakov had organized for like post high school, he had mentioned that he had encountered something about evolution in his psychology curriculum. And I was like, oh, he's a good person to talk to. So I called him. I still remember his answer. He said to me, so when you learn about evolution, you're going to learn a lot of things that sound very plausible and sound very true. Like you're going to learn how the influenza virus mutates from one season to the next, and that observes, the principles of survival of the fittest, etc. He's like, but just remember that when something is 99% MS, it's 100% check error. Like basically he was saying like, if everything, like it's all scientific and it makes sense, but the premise is not acceptable or not, not LP Torah Hashkafa, then it's like, it's 100% check error. So I remember he said that, and I ended up doing really well in the course. I was like, I'm going to show this guy that you can believe in God and be a scientist. It was a class of 2000. I got the third highest grade and I got a certificate, and I wanted to like wave it in his face and be like, see, I believe in God. You're wrong. Anyway, so that was that.
That's really amazing that you found the mentors that could get you through that time in your life. And then your next step was medical school in New York. Did you know you wanted to go to New York specifically? How did you end up in the United States? What was the process involved in that?
Yeah. So at that point, I was like 23. Yeah, it's a little bit ridiculous to look back at this. But I felt like I was super old. I had actually like rushed my degree. Once I started U of T is a conventional, best college in Canada, 4-year degree body, 4-year degree granting body. Like, and I was like, I'm over the hill. I need to finish this as fast as I can. I had a whole plan for myself. I was going to cram in as many credits as I could, like during the year and during the summer. And I was going to, because I know volunteer experience, and I had to take the MCATs. Like I had a whole tachnit. There was like no room for error. I had to get an A on everything. So it was crazy time. And I remember I spoke, I think I told you this. I called a good friend of mine in Lakewood, and she's like, when are you finishing your degree? And I was like, it's going to take 2 years. She's like, why is it going to take 2 years? Like, can't you just like clep some courses and finish already? It was funny, but I hadn't prepared for it. Like I didn't get any degrees from seminary, because before I went to seminary, I didn't think I was going to need those degrees for college. And I was, really starting. I mean, I managed to take the correspondence courses and use them for some credits or whatever, but I really started from scratch. So anyway, I felt like I was very old. And the thought of being 27 at the end of this and stuck in Toronto where the dating scene, I was just like, this is probably not a good idea. And a lot of so I had some friends, like I said, who were in New York University, and they were all moving to New York when they graduated, which was around the time, around the same time. So I had a lot of people making that move for dating. And this family friend who had a daughter in medical school from Toronto, she was in Mount Sinai. So, and it, like the way she described it, like I thought it was a little piece of heaven. She lived on the Upper East Side, and she used to go jogging in Central Park every morning. And then she would sit in class, like just imbibing all the knowledge. I was like, I'm going to go to Mount Sinai Medical School, and that's going to be my thing. And then I'm going to, date and like meet a nice guy. I don't know. So I had this idea, like, yeah. So that's, I mean, I think the dating thing was really what drove me to move to New York at that point. They say man plans and God laughed, like and God laughs. I went to my Mount Sinai interview, and the guy who interviewed me was about 75 years old, and he was like, maybe even older. He was like this Jewish psychiatrist, sorry, who really had a thing about from people. And he takes one look at my transcript, and the first thing he says to me was like, what's a Bais Yaakov girl like you doing applying to medical school? And I was like gobsmacked. Like, I didn't know you could talk like that. Like I thought medical school interviews were going to be all PC, but this was like, what's a girl like you doing applying here? And that was a complete wash of an interview. He threw this crazy ethical dilemma. They give you like a scenario. He was like, I have this Hasidic patient, and her daughter is really, and this was 25 years ago. So these scenarios were like totally like not anything anyone discussed. And it's like, she's biologically male, but she doesn't know it. And she's married in this Hasidic marriage, and they're praying for a baby, but really she's male, so she can't have a baby. And like, they're running to rabbis for blessings. What would you do? Like, would you tell the girl that it's really a man and she can't have children? And I was like, what? Like, I was like, this, like, what are you doing? Like, you're just trying. It just really felt like he was really trying to ambush me. And I was like, how did she not know that she's a man? Like, how do you get to that stage in your life and like never menstruate? He's like, oh, she had a blind flow. It's fine. Don't worry about that part of it. Answer my question. Anyway, so that was that. At the end of the interview, he said, he looks at my MCAT score, and I had done like fine on the MCAT, but I had done really, really well on the writing score sample, which is no longer part of it. I'd gotten a perfect score. And he's like, is this a mistake? You got a T. I've never seen a T. Is that a mistake? And I was like, no, I'm a really good writer. like you take your prejudice and throw it out the window. But anyway, I did not get into Mount Sinai. I did get into Einstein. I loved Einstein. I had a really nice chabra. I was still like, I was the Bais Yaakov girl there, even though like everybody looked like me. They all, we all wore the same skirts and ate the same food. Like, at the end of the day, my background was definitely more right-wing than my classmates for the most part, but it was a nice chabra. We ate Shabbos meals together. We studied together. We, went through the hard times and the good times. We did anatomy lab together. It was really nice. So anyway, that's why I went to New York. And in the end, I finished medical school and was not yet married. So I moved to the Upper West Side, and I did a Shomer Shabbos residency at Beth Israel, which was in Lower Manhattan. And that was like living on the West Side was really a great experience. And so that's why I was in New York. It was primarily for dating and for a social life too, because at some point when you're in an out of town community beyond a certain age, a lot of the girls your age tend to move on as well. So, so it's sort of a dual prong thing.
We were talking a little bit about like mentors that you had in undergrad. Do you have anybody similar that you could talk about from medical school? Like who guided you through it? Who'd you ask your questions to?
Yeah, it's a good question. Ellen Warner, she's amazing. She's been there like every step of the way. Like I would even call her now with a professional career question. So from a career perspective, she's definitely been there for me with medical school. And I would say this is the one big thing that I hadn't really thought about, again, because I wasn't approaching medicine as this like thought out lifelong dream. That it was really something that came to me, I would say, independently. And, it wasn't part of like a social, like a society thing. And what I mean by that is like sometimes when it's a bigger discussion, you know about some of the pros and cons. And the one thing that really hit me hard when I was applying to residency was the Shabbos issue. Now, it wasn't something that I had honestly considered very much in the past, but a lot of my contemporaries were going and applying for Shomer Shabbos residencies. Now, the residency I really, really, really wanted, and I had worked for 4 years of medical school to do research and get to know the right people, and they really liked me, and they didn't actually interview that many other people because they thought I would take the spot, was radiation oncology. Radiation oncology is like medical oncology, except it's a lot easier in terms of the training. It's shorter training. There are no overnights. The salary when you graduate is higher than medical oncology. And, there are a lot of positives, like it's very technical. There's a lot of research that goes into, all the decisions you make as a radiation oncologist, et cetera. So it was something I really wanted to do. Now, getting a Shomer Shabbos spot, it's very hard to match into radiation oncology, but to match in a Shabbos program was like, there was a program that did a Shabbos spot in downstate New York, and they were not going to do it again. They were like, we're not doing this. There was a program in Syracuse that offered me Shabbos. I thought living in Syracuse for 4 years would be a very bad idea as a single Jewish woman, just because I didn't know anyone there and whatever. And so I took my question about Shomer Shabbos to David Feinstein, and he gave me a lot of time. I sat down with a from radiation oncologist, and he answered all my questions about like how to do it in a way that might be compatible with halacha. And in the end, he really told me not to pursue that and to go for a fully Shomer Shabbos residency option. There was one program that I could have worked it out to do Shabbos in, not officially, but basically the big issue that he did not want me to do was to get into a car and move around to various hospitals on Shabbos. And Columbia was in the Upper West. It's like in Morningside Heights or Upper West Side, whatever. Not Upper West Side, Washington. It's near Washington Heights, and there's only one hospital to cover, and it's walking distance from where I would have been living. So I could have worked it out possibly to be Shomer Shabbos with a spot there, but I thought that it was a reach. Like I did not think I would match there, because when I went to the interview, everybody else on the interview, without exaggeration, was like an MD, PhD from Harvard, and here's like little Chana Weinstock, MD from Einstein. So I really didn't think I'd match there. In the end, they really overshot. At the time, the program was struggling. The candidates they interviewed were, even in a competitive field, were like way too competitive for the program, and they ended up going unmatched. So I probably would have matched there just because I interviewed there. But I had to commit to my Shabbos program outside the match. And so anyway, so yeah, that was, and then in the end, Einstein called me back the next year. I spoke to Einstein the next year. They offered me another spot out of the match in radiation oncology because they were adding spots. And David Feinstein again advised me not to do that. So he was definitely there for me when it came to halachic questions. That was really the big one. I didn't have that many other ones. But yeah, I think it's important. Like these are weighty questions, right? Like working on Shabbos and that kind of thing. And it is important to have someone that you could ask these questions to. And I think as women, sometimes it can be hard because you're not really connected in with halakhic authorities, but he was very available for me. My brother learned in the Lower East Side all the years, so I had access to him, but he learned in MTJ. He was around of it. So he became, he was the one I asked my questions to.
So it sounds like your career had a little bit of a different path than you originally planned. Like you were thinking radiation oncology, now you're medical oncology. Looking back, I mean, obviously there's no regrets, but like if you could do it in a Shomer Shabbos way, do you wish you would have? Were you happy the way things worked out?
I think so. I mean, I think it's interesting because the position I have now, like I love what I do. I really, it's such a dream job for me. I don't actually see patients anymore. I've been at the FDA since 2015. For a while, I was doing a continuity clinic at the VA, but like, in terms of a personality fit, that's one thing you'll discover about medicine. Like, there's so many different ways to do medicine. Like anesthesia, I tried anesthesia for like, I think it was supposed to be a 2-week rotation to see if I liked it. I think I lasted 2 days. Like, it's a great career, and half my class did it, and half the firm guys in my class did it. Like, it's such a great career. Like, it has to fit your personality, like the pace, the skill set. And I definitely think what I do now, which is clinical trial design and clinical research, and like it's a really good fit for me. The pace, like I get to think about things, I get to talk about things, like I don't have to like push this and push that, and it works well. Now, would I have gotten to where I am with a radon background? Possibly, but I think there's a reason for everything, and I am where I am because I was meant to be here. It was definitely some moments of heartache when I had to give that up. But I think it all worked out, Baruch Hashem.
It sounds like it did. And as far as like doing residency, you had a Shomer Shabbos position, so that eliminated like the Shabbos problem. But did you find any other like challenges to being a frum girl in like a very non-Jewish environment? What specifically like did you face at that point?
So, there were enough Shabbos residents with me that, not so much of an issue there, because everybody knew us. In fact, it was almost the other extreme. Like when they would start a rotation, they'd be like, "Oh, I'm being sabotaged this month," or "sabotaged." Yeah, I mean, I think you just end up finding yourself being like the role model for everybody, kind of like the person they come to you with all their questions and all of that. 1 second, let me just put on my headset. Oh, okay, sorry. Yeah, I mean, I can't really, I think probably training right now is a lot harder than when I was training because of the whole Israel-Palestine thing, which was like not an issue, but I really did not encounter, there's a lot of diversity in the medical workforce, right? And so you're just a little diverse in one way and someone's diverse in a different way, but it's like a big tapestry of everybody. And as long as you do your job and you work hard, and I will tell you one thing. When I started my fellowship at Maryland was Shomer Shabbos. And the reason why it was Shomer Shabbos was because there was a fellow 2 years ahead of me. He actually is now an oncologist in New York. His name is Dr. Azriel Hirschfeld. And when I started my program, on my interview, the person interviewing me asked me if I was interested in the Shomer Shabbos program. I didn't bring it up. She brought it up. And I was like, oh my gosh, like, yeah, sure, of course. Like, the reason why she was so interested in offering it to me was because he was like this shining star. He made himself so beloved to everybody that like they wanted another resident who was Shomer Shabbos. Basically, what he did was like he overhauled the VA schedule, like where we did our continuity clinic. He like redesigned the whole VA schedule so that it worked well for the residents. The Shabbos system he designed was that like he would take call from Friday. I'm sorry, the other resident would take call from Friday night to Saturday night, and then Shabbos person would do Saturday night, Sunday night. So you were doing more of the weekend. And I remember I spoke to him at the beginning of my fellowship experience, and I was like, tell me, like, what should I know before I start? He's like, make yourself indispensable. Like, you want to be the first person to offer to do, if someone's kid has a performance in school or something, if like somebody needs to go to the dentist to get a root canal, like you want to be the one to cover, and you want to be the first to offer, and you want to be the person that they want to keep around. And apparently it worked, because they offered me a Shomer Shabbos residency. Now, I don't think I did a very good job, because there was a fellow a couple years after me, and I was like, oh, it's Shomer Shabbos. He's like, really? And then he went to them and he asked if they could work out Shabbos for him. And the leukemia attending said, well, everything except for when you're on the leukemia floor, you must be there on Saturdays, which he didn't really have to be. But anyway, so I was like, I guess I wasn't the shining star, but he was really like, you need to be endearing to people and make people love, what you stand for. So
Absolutely.
I don't know if that answers your question, but anyway.
Yeah, it does. I think that it's very important when someone's in a Shomer Shabbos residency to realize that, if it causes any sort of like strife in the program, if people are angry and upset and complaining to the program director, they won't want to continue. So it's your job to make people happy, make sure they don't resent you, and, make them happy whenever way you can, like you were saying. That's definitely relevant. So what is your, you ended up in oncology and working for the FDA. What does your regular work life look like now?
Yeah, so it's, it was before COVID and after COVID. So my job is in Silver Spring. There's a big campus there where the FDA main offices are, and there's like tens of thousands of people who work there, including everybody in my office officially. Since COVID, we've been mostly virtual. So I work from home. We started going back to the office one day a week. So, it's a full-time job. We're super busy. We're reviewing and approving drugs, new drugs or old drugs with new indications for cancer treatment. And yeah, so I do that pretty much all day. I meet with drug companies. I meet with my other team members internally. And we basically spend all day thinking about clinical trials and trial design and drug safety and all of that. And I love it. So yeah, I do that all day. And then I always say, even though I'm virtual now, I don't feel like I gained time in my day, because my kids come home at, my oldest, I have a 2-year-old, so has a babysitter in the afternoons, but my 6-year-old comes home about 4:10, and that's when my workday has to stop. So it used to be I was in the office like at, in Silver Spring till like 4:30, and then I would drive home and come home at 6. So in the end, I don't actually work any less or more. It's just more flexible. So, and, I go to conferences and I organize workshops about different topics in oncology, along with the people I work with and outside experts. And it's just, it's a great life. I think at the end of the day, I sometimes think about this. If I would have followed the trajectory that I thought I would follow, which was, graduate from BJJ, take a teaching job, become a kollel wife, I got married when I was 29. That was not part of my plan. It was part of Hashem's plan, obviously, not mine. I think I might have been one of those women who, I just turned 46. So I think I would have been a 46-year-old who had all these ambitions that were never really actualized, never even articulated, because I didn't know I could. And now I have this job I love. Like, it gives me such fulfillment and satisfaction, and I love what I do. And you probably have the same thing. And the fact that can be part of my life is like such a huge bracha. I thank Hashem every day for my job and for my career. And it's just, I don't know, something I don't take for granted, and I'm hugely grateful for. Anyway, I'm happy to answer any questions if anyone has anything they'd like to ask, because I could talk all night, but
I'll stop the recording so you can unmute yourself, talk, put it in the chat box, whatever you'd like.